Now coming on to the next question on regenerative endodontics, which of the following is the most crucial, keep this in mind, most crucial step in revascularization. So basically under regenerative endodontics, we are coming to the revascularization, that is the blood vessels which are being destroyed is being regenerated. Okay, so which of the following is the most crucial step in revascularization that facilitates the regeneration of the pulp dentine complex? Okay, so along with the blood vessels, you're also getting the pulp dentine complex. Now this is a little controversial, the dentine, will come to that. Okay, but now so what's the most important step? Is it application of the triple antibiotic paste? Is it inducing a bleeding to form a blood clot in the root canal? Is it the final steps like insertion of a permanent filling or complete removal of the pulp tissue? Please note, before going any further, I want to tell you two very important steps, two very important steps in regenerative endodontics. One is disinfection. Okay, one of the very important steps is disinfection, and the second very crucial step we have is inducing the blood clot formation or inducing bleeding, thereby formation of a blood clot. Now you will see that this is the first option and second options. Okay, now I'll come to the remaining options also to give you an understanding, but yes, to choose between these two, which is important. Now before that, for disinfection, what do you use? Most commonly the book says triple antibiotic paste. Now when I'm discussing this, I'm discussing based on standard references. Okay, so triple antibiotic paste, that this is from Cohen. Okay, and please note one more thing just to add here, for disinfection, please understand that this is done everywhere, isn't it? Though we are using different materials, disinfection is definitely a step in any endodontic procedures you do, not just in revascularization. But inducing the blood clot, okay, inducing the blood clot is something which is different. This you don't do, you know it, right? So what is the purpose? Basically, you induce bleeding within the root canal. Okay, and this blood clot, please note, this contains fibrin. We already discussed fibrin is among the natural scaffold, isn't it? So this contains, you know that the blood clot contains fibrin. So this acts as a natural scaffold. Now what does it do? What does scaffold do? This helps in the migration and growth of stem cells. Okay, migration and growth of stem cells. Okay. Now why is it important? Okay, as well as a space for growth factors. Now this is the one, okay, this stem cells is the one which helps us for the regeneration of the pulp dentine complex and the blood vessels and restoring the vitality. Okay, so this is what the most important step is, inducing the bleeding, because by this only we have all the things happening. Now as I've told you, there are two more options remaining. Insertion of permanent filling. Now this has to be done anywhere, isn't it? Any endodontic. Complete removal of pulp tissue. Now this is a typical thing which we do in your conventional root canal treatment, isn't it? When you're doing a vital endodontic therapy or when you're doing your regenerative endodontics especially, you don't remove the entire pulp. Your purpose is just to remove necrotic infected pulp. Okay, necrotic or infected pulp, you don't remove the entire. Complete removal is a part of your older versions of your root canal treatment. So that was that question. Now coming on to this particular question, what is the role of, now you will easily understand this, okay, what is the role of blood clot during revascularization? Now as I've been telling you, use your a little bit of logic. Try to eliminate two options, because this comes only with practice. So you have to practice as many number of questions in this way from your test papers on the app, from the practice questions on the app. Okay, you'll continuously get this. So see, this if you use a logic, you know that this is not used. This is also not used. Okay, I mean, I'm sorry, not that not used. Both of this is used for. In fact, this is not the purpose. Okay, and if at all you use it in any endodontic procedures, as well as triple antibiotic placed. Again, it's disinfection. It's also not a specific procedure only for your revascularization. What is specific is this, so that you can rule out by elimination. I know that it is not easy, but with practice, with learning, with building up confidence, this happens. Okay. Now, what is the role of blood clot? Now, let's see the options. To serve as a temporary filling material, never. Okay, yes, basic sense says it. Now, to act as a scaffold. Now, this is what we said. Okay, the blood clot contains fibrin, and this fibrin can be used or can act as a scaffold for the growth of stem cells. To prevent further infection doesn't make sense. To provide an immediate pain relief. Now, it's very direct. Now, what happens with majority of the students, the moment they see this blood clot, especially those who are using that typical MCQ books, I don't want to name them, but then typical MCQ books and trying to buy hard things out and saying that, okay, this is what is going to get repeat, and they have never solved their new questions, they have never used or they have not provoked their thought process. Blood clot and revascularization, I don't know, I'll skip. But see this, the options are so direct that you easily know that these three are not the options. Again, I'm not saying that this will happen all of a sudden overnight. No, this comes with confidence building and practice. But yes, this is how you answer many of the new questions. Okay, this is taken directly from your Cohen. Okay, now again another very crucial question taken directly from your Cohen. Maybe a little controversial based on different researchers, but then what your book says is more crucial, isn't it? What I'm saying, I don't mean that, see, some researchers the researchers are always controversial. Some people say it is like that, some people say it is like this. But what your standard textbooks say is this, more important for your need. Okay, so most recent research, okay, what does the most recent research suggest about the type of mineralized tissue deposited in the revascularized teeth? Now, definitely the confusion you will have, most of you will think, I'll use some other colors too. Okay, is it new dentine? Is it cementum? Or is there no formation of mineralized tissue? Definitely not enamel. Okay, you don't get enamel anyway. So, the confusion is going to be, again, no mineralized tissue, again, then what is the purpose of regeneration, isn't it? So, you can either have cementum or new dentine. Now, here comes the trick, okay, that, as I've told you, if you can eliminate two options, try to guess one. I've told you the rule, isn't it? 8:2 rule, isn't it? So, of knowledgeable guesswork, knowledgeable. Now, you have to think a little bit, use your intuitions. Is it new dentine or is it cementum? Sometimes you use your thought process in such a way that if it was new dentine, they wouldn't have asked this question most of the time. So, answer is cementum. The other way people will think is, as I've told you, pulp dentine complex is regenerated. Okay, then you will say that it is new dentine. But the answer is cementum. Okay, what is being shown is the dentinal walls. Okay, you have your tooth, your pulp inside. So, you have your dentinal walls. Okay, in different areas. If at all you want to regenerate it, if it has been destroyed, you get what is being replaced is your cementum, okay, and not new dentine. This is based on the most recent research. Okay, this is what I told you. The opinions might vary and it might even change as we go on, but this is again based on taken from your Cohen textbook. Okay, so that is about this particular question.